Hi, I'm Dr. Sam Dubé. I'm here to talk to you today about over-supination, its symptoms, the underlying cause, and the benefits of different treatment options. The symptom of over-supination is usually a high, rigid arch. Over-supination of the feet is a relatively uncommon misalignment. Supination is a natural movement that occurs when an ankle rolls outward and the soles of the feet roll inward toward the body's midline. Many people believe that over-supination is preferable to pronation, the much more common foot misalignment. However, all types of misalignment have repercussions, the most important being catastrophic failures, such as stress fractures and, to a lesser extent, tissue strain through distorted, weight-bearing body parts. What causes over-supination? Over-supination occurs when there is a dominance of the muscles that invert the foot, especially the tibialis anterior. The side-to-side mobility of the feet and ankles is controlled by inverter muscles that cause the sole of the foot to face inward towards the body's midline and everter muscles that cause the sole of the foot to face outward. These muscles pull against each other. In most instances, the everter muscles have been conditioned to be inactive and are unable to balance the foot alignment against their antagonists, the inverter muscles. In this case, the body is unable to create and maintain an ideal dynamic arch system. For proper function, our feet require right stimulus and the right movement. Right stimulus consists of the varied, subtle stimulus that the soles of our feet receive when we walk, especially when we walk barefoot on natural terrain. With each step, there are subtly different sensations. These subtle differences in stimulus keep our brain on high alert so that our body's protective reflexes function properly with optimum muscle function. When our brain is uncertain about what will happen, it triggers protective reflex muscle activations that support our arches even before our feet contact the ground, to ensure that our feet and legs can safely manage the forces generated by the activity intensity of our bodies. As activity-related stimulus intensifies, a progressively higher arch is created. That's why, when they're functioning properly, our arches and toes rise and fall dynamically in response to the varying activity stimulus intensities. This uninhibited dynamic movement is right movement. Right stimulus and right movement prevent the imbalanced muscle function that contributes to over-supination. Conventional footwear impairs optimal foot function in two ways. First, most conventional footwear dampens right stimulus. This is particularly true for shoes or insoles that support or cushion our feet. They spread the forces evenly across the soles of our feet, creating sensory input that's muted and repetitive, step after step. Within a short period of time, our brain tunes out the stimulus and simply stops responding to it. As a result, our brain doesn't sufficiently activate the muscles that stabilize our arches and properly align our feet, legs, hips, and lower back before our feet contact the ground. This tuned out brain response is natural, and it actually happens all the time. The same thing happens when we walk into a room and first smell the coffee, and then after a few minutes, we don't notice the smell at all. Second, most conventional footwear, especially footwear that's tightly laced, has snug toe boxes or stiff midsoles or outsoles, restricting the right movement dynamic raising of the arches and toes that is just so critical in the creation of a strong, stable arch system and healthy linear propulsion with the toe-off forces spread across the forefoot. Impaired right stimulus and right movement lead to the unbalanced muscle function that contributes to over-supination. Conventional treatment methods for over-supination include the following: heel wedges, foot or shin taping, supportive products such as orthotics, and therapeutic exercise. Now, while these methods may temporarily alleviate symptoms, they simply don't address the poor neuromuscular function that's the real cause of the problem. In fact, the more we artificially support or cushion our feet, the weaker and the more dependent we become on these types of products. Now, these old school support and cushioning treatment methods are actually not recommended in any other area of musculoskeletal medicine as a viable long-term treatment option. In fact, today's modern treatment methods for poor neuromuscular function focus on increasing mobility, muscle strength, and proper alignment via proper technique exercise, which requires both right stimulus and right movement. Science has shown that simply challenging the body to do its job is the finest way to restore and enhance function. To address the poor neuromuscular function that causes over-supination and prevents it from recurring, I recommend the following. Walking barefoot on natural terrain as much as possible. This provides the optimal right stimulus and allows for the right movement required for healthy neuromuscular function. To obtain right stimulus in your conventional footwear, use BioPods stim soles. For best results in conventional footwear, use BioPods stim soles in loosely laced, soft, flexible footwear that allows your arches and toes to rise easily. For optimal neuromuscular function while wearing shoes, use BioPods footwear, which are specifically designed to provide the right stimulus and facilitate the right movement that optimize and encourage healthy foot, leg, hip, and back function. Remember, consult with your healthcare practitioner and ask them about employing soft tissue mobilization therapies to address the fibrotic scar tissue that may have formed in the past.